Hello, my name is Samantha Montalegre and welcome to the Maternity Mentor. Today's topic is how to interview a certified nurse midwife. Thank you for joining us. Today we will be discussing how to interview a certified nurse midwife in 8 easy categories. I've been a registered nurse for 11 years. I've spent my entire career working in the maternal newborn nursing area, including mother-baby postpartum, NICU, antepartum, and labor and delivery. I have practiced as an IBCLC for 8 years and have been maternal newborn nursing certified for 7 years. I have also received specialized training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Why should you interview your certified nurse midwife? This provider will guide your care for the next 9 months. She'll be entrusted to follow your birth plan, and she will need to decide whether medical interventions are needed. Please remember, many of these questions apply to both a certified nurse midwife and an OBGYN. However, there are some differences. Please see our video on how to interview an OBGYN to learn some of the different interview questions. Let's start with the office. It's important to understand the operation and policies of the office, as you will interact with them a lot. For example, do they take your health insurance? What are the terms for fees not covered by your health insurance? What are their office hours? Are there any evening or Saturday hours that are more convenient for your schedule? Next, it's important to understand your provider's education and training by asking such questions as, when and where did they receive their training? Are they board certified? Do they have professional or patient references that you can receive? How long have they been in practice, and how many babies have they delivered? A provider's personal practice or philosophy can highly influence their decision making. You want to ask them, why did they become involved in midwifery? And what is their basic philosophy of birth? What does informed consent mean to them? Informed consent is permission given by a patient to a provider for treatment with full knowledge of the possible risks and benefits. This often arises during emergencies, so it's important to make sure you and your certified nurse midwife are on the same page. Continuing with practice questions, be sure to ask how they feel about pain management. Some midwives like all their patients to receive an epidural, while others focus on natural pain relief. You may want to have a natural birth with no anesthesia, or you may want an epidural when you walk through the door. Having this conversation about pain management beliefs up front can keep you and your midwife on the same page. It's important to understand the logistics of your birth and what your provider likes to do. You should ask very detailed, comprehensive questions to make sure you understand how things will work and the flow of the care you will receive. These questions include, at which hospitals or birth centers do they have privileges? Do they attend or offer home births? When do they like their patients to come into the hospital in labor? How many babies do they deliver per week? How many women do they care for at once? What will happen if somebody else goes into labor at the same time you do? Can they share with you statistics from their previous births? Do they ever have to reroute patients to another practice or hospital when they are overcrowded or overbooked? Include questions about communication, like who do you call if you have a question, and who responds to that call? Do they accept questions via email? Will they discuss health problems or test results over the phone? Is there a charge for such telephone time? What if you have an emergency outside of office hours? How much time is allowed for a routine visit? Additionally, you want to include questions about birth preferences, such as, are they supportive of you writing a personal birth plan? A birth plan is a written agreement between you and your provider as to how your baby will be delivered. It gives the parents more of a role in the decision-making process. However, the plan is no guarantee that your birthing process will go as planned, because complications can arise. If there are problems, your midwife will make decisions based on what is safest for you and your baby. Another question to ask is if you are allowed to take photos and/or video during your delivery. Many providers will allow you to take still photos during labor and delivery. However, you do need their consent. Additionally, the birth location may have their own policies on this practice, so inquiring up front is important. Many providers and birth locations will not permit video. Additionally, question whether professional photographers are allowed in the room, because some policies limit the number of people in your delivery room. Birth control options post-delivery are important to many women. Make sure to ask, what birth control options does your provider offer after delivery? Many providers will offer a variety of birth control options, including birth control pills, IUDs, and natural family planning. However, some providers will not offer these due to religious reasons. So if this is something you desire, be sure to ask up front. Can they recommend an OBGYN to you so that you may receive a tubal ligation? A tubal ligation is a surgical procedure to prevent pregnancy permanently. Many women desire permanent birth control after delivering a desired number of children. Being able to get a trusted referral from your certified nurse midwife allows you to receive this care. Inquiring about your provider's collaboration allows you to learn who else may be involved in your care and delivery. Your primary provider may not always be available for every visit or your delivery. It's important to understand who you may receive care from and whether that is acceptable to you. Key questions can include, are they in a group practice? How many providers are in their practice? How many deliveries does their practice handle per month? Do they have a partner or birth assistant? Do they have a connection to a physician and/or hospital if you need to transfer? Do you have a choice about who you see and who delivers your baby? Some women prefer female providers for a variety of reasons, including comfort or religious requirements. It's essential that you understand who you may see and if you're comfortable receiving care from all possible providers. Additionally, ask whether you will see the same primary caregiver at each appointment, or will you often see others in the practice? Group practices often rotate providers so patients see everyone's face and have a chance to interact with these providers. Make sure you understand if this is a requirement of the practice so you are prepared to see new people at each visit. Additional practice questions can include, what is the practice's philosophy or mission statement regarding birth? Do they recommend any birth classes? How do they feel about you having a doula? How do they feel about you obtaining a second opinion? Ask the provider, what is the likelihood they will be on call for your birth? Will they be in town around your due date? There is no guarantee that a specific healthcare provider will be available to deliver your baby, since no one works 24 hours a day. Make sure you know the other providers in the practice or the providers with whom the midwife shares delivery responsibility. Make sure you ask your provider about birth interventions and possible complications. These unexpected situations can be very stressful for parents, and knowing how your provider will handle these, should they arise, can relieve some of that stress and anxiety. Questions should include, do they handle high-risk pregnancies? What is their policy regarding induction as a practice? How often do they induce? Why do they induce? And what methods do they use? How do they assist with second stage pushing management? How do they handle labor problems or complications? What do they consider a birth emergency? Do they support water birth? What is their episiotomy rate? An episiotomy is a surgical incision of the perineum during the second stage, the pushing stage of labor, to quickly enlarge the opening for the baby to pass through. Some providers perform episiotomies as a rule, where others choose to allow for natural tearing that may occur. Additionally, ask, do they use traditional medicine to induce labor, and what do they use? Do they require an IV or other medication during labor? What natural methods do they use to alleviate pain during labor? Will you be allowed to move freely and to try different positions during your labor? Do they require continuous electronic fetal monitoring during labor? Electronic fetal monitoring is a machine applied to your belly using straps that allows providers to monitor the baby's heart rate during labor as well as the strength and pattern of your contractions. Electronic fetal monitoring can limit the ability to utilize natural labor positions, and many do not allow for ambulation or water immersion, such as a tub or shower. Some important questions related to the care of your baby include, are they certified in neonatal resuscitation? Do they have the equipment necessary to stabilize an infant in an emergency? Additionally, when under the care of a certified nurse midwife and delivering at an alternative location other than a hospital, it's important to understand what happens when things change. Make sure to ask at what point in labor would they transfer you to a hospital. Make sure you ask and understand the standard testing your midwife will expect. Testing can include blood tests, ultrasounds, consults with other providers like a perinatologist, and invasive testing like amniocentesis. Many tests come with additional costs, so you want to be clear what testing will be required as part of your plan of care. For example, what are their thoughts on first trimester invasive genetic testing? What prenatal tests do they require and why? What prenatal tests do they recommend and why? How many ultrasounds do they order and when do they order them? Do they routinely test at the end of pregnancy for preeclampsia and/or tests of fetal well-being? What are their thoughts on cervical exams in pregnancy? Cervical exams involve the practitioner inserting their hand in the vagina to check how dilated the cervix is. These exams can be uncomfortable and, while performed using sterile gloves, can increase the risk of infection. Most providers need or want to perform regular cervical exams starting at 38 to 39 weeks as well as during your labor. Care doesn't end in the delivery room. It's important to know how your provider will support you during the postpartum period. Postpartum care starts at minute 1 of life for your baby. Make sure to ask your provider the following questions. Do they support and assist with cord blood and tissue banking? Cord blood and tissue banking is storing some umbilical cord blood and tissue for future use. Do they routinely protect the golden hour after birth? This first hour after birth, where the newborn transitions from uterine life to life outside of the womb, is considered the golden hour. Do they allow for the breast crawl prior to infant measurements? The breast crawl is the instinct in an undisturbed newborn to move towards the nipple and attach to the breast fry themselves through a series of predetermined steps. Allowing a newborn to perform the breast crawl increases breastfeeding success. Do they have a provider they can recommend for circumcisions? How do they support breastfeeding goals? Do they offer breastfeeding classes or a support group? What can you expect from postpartum visits with them? How many visits will you have and how close after delivery? What are their thoughts on placenta pills? Placental encapsulation is the practice of ingesting the placenta after it has been steamed, dehydrated, ground, and placed into pills. There have been reports of infections in both mothers and babies after utilizing this practice, and the process of placental encapsulation is not regulated. Therefore, your provider may not support this practice. On the flip side, your provider may suggest this practice to you. If you plan to use placental pills, ask your certified nurse midwife what their thoughts are and if they will support this practice. We hope this information will help you on your journey to find the right provider for you and your family. Please share your comments below and let us know what other topics you'd like to hear about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those down below. Thank you so much for joining us at the Maternity Mentor.